Hey everyone, thanks for joining us for another deep dive. We've been hearing a lot from you about superbugs and antimicrobial resistance.
Right.
And it's definitely something that's been in the headlines quite a bit recently.
Yeah. It's a hot topic for sure.
So we wanted to take a closer look at a new research article that really digs into this whole issue of antimicrobial resistance, especially in the ICU. So
Really important area to focus on.
it is. And this paper, the title's a bit of a mouthful, but it's called Antimicrobial Multidrug Resistance: Clinical Implications for Infection Management in Critically Ill Patients. It was just published in the journal Microorganisms.
A lot to unpack there.
Yeah, so we're going to try to break it down for you and kind of give you the highlights and maybe some of the things that you should be thinking about.
Sounds good.
So one of the things that really jumped out at me from this article was just how big of a problem this is becoming globally. They're predicting that by 2050, antimicrobial resistance could be responsible for something like 10 million deaths every year. I mean, that's a staggering number. And it really kind of puts it into perspective, how serious this is.
And it really highlights the need for increased awareness and action because we can't ignore a problem of that magnitude.
Right. And, the article really focuses on the ICU as kind of being ground zero for these types of infections. What is it about the ICU that makes it such a breeding ground for these superbugs?
Well, you've got a lot of factors converging in the ICU. You've got patients who are already vulnerable, often with weakened immune systems.
Right.
They're undergoing invasive procedures, which can create opportunities for bacteria to enter the bloodstream.
Okay.
And there's a high concentration of antibiotics being used, which can create selective pressure that favors the survival of resistant strains.
So it's like a perfect storm.
Exactly. It's a perfect storm for breeding these resistant pathogens.
And this article goes into some pretty specific examples of, resistance trends that they're seeing emerge and that they're concerned about.
Yes, one that really stood out to me was Klebsiella pneumonia. This bacteria is becoming increasingly resistant to multiple common antibiotics, and this is a serious concern because it can cause a wide range of infections, from pneumonia to bloodstream infections.
Yeah, and those can be really difficult to treat.
They can be very difficult to treat, and we're seeing some really high resistance rates in certain parts of the world. There was a study in India in 2022 that found a 100% resistance rate to certain antibiotics in some cases.
100%, that's scary.
It is a concerning trend, and it really highlights the global nature of this challenge.
So it's not just a problem in one particular region or country, it's something that we're seeing all over the world.
Right, it's a global issue.
And you mentioned Klebsiella pneumonia. Are there other types of bacteria that are sort of topping the list of concerns right now?
Well, we used to be really worried about things like MRSA and VRE,
Right.
methicillin-resistant Staphylococcus aureus and vancomycin-resistant and Enterococcus.
Right.
But now the focus is shifting more towards these multidrug-resistant gram-negative bacteria, or MDR-GNB for short.
MDR-GNB cat.
And these are particularly concerning because they're becoming resistant to some of our most powerful antibiotics, like carbapenems.
And I know from previous conversations we've had that when you start talking about resistance to carbapenems, that's when things get really serious.
Absolutely. Carbapenems are often considered our last line of defense against these multi-drug-resistant organisms.
Right.
So when they start to fail, we have very few treatment options left.
And this paper actually mentions that there's a specific type of infection, carbapenem-resistant enterobacterales, in the ICU that has a 40% mortality rate.
Yeah. That's a really sobering statistic, and it really underscores the severity of this problem.
So we've established that this is a global threat. It's particularly bad in an ICU setting. But how do we even know if someone has one of these MDR infections? What are the warning signs? What are the things that doctors are looking for?
That's the million-dollar question, isn't it? Because
Yeah.
it's not always obvious, and it can be really challenging to predict who's going to develop one of these infections. But there are some risk factors that we look out for.
So red flags, essentially.
Red flags, exactly. So one of the biggest ones is previous exposure to antibiotics.
Okay.
The more antibiotics someone has been exposed to, the more likely they are to harbor these resistant bacteria.
That makes sense.
It's like survival of the fittest. The bacteria that are able to survive the antibiotic onslaught are the ones that are most likely to stick around.
So the more we use antibiotics, the stronger these superbugs become.
That's the general idea, and the longer someone spends in a healthcare setting, especially the ICU, the greater their risk.
Because they're exposed to more things.
Exactly. More antibiotics, more resistant bacteria. It's just a numbers game.
And then there's this concept of colonization pressure.
Right.
which I've heard before, but I'll admit I'm not entirely clear on what exactly that means.
So colonization pressure basically refers to the burden of resistant organisms present in a particular environment.
Okay.
So the more colonized a patient is with these resistant bacteria, the higher the chance they'll develop an infection from those bacteria.
So it's not just about whether they have the bacteria, it's about how much of the bacteria they have.
Precisely, it's about the sheer number of those resistant microbes present. And this is particularly important in the ICU, where patients are often colonized with multiple types of bacteria.
So it's like the more you have, the higher the risk.
Exactly, and this colonization pressure can really complicate treatment decisions.
So we've got the previous antibiotic exposure, we've got the length of stay in the hospital and the ICU, and this colonization pressure. Are there other things that doctors are looking at to try to assess risk?
Yeah, there are a few other things they consider, like if a patient has had an invasive procedure.
Okay.
Things like surgery or having a catheter inserted those procedures can increase the risk of infection.
Right.
And being on a ventilator is another risk factor
Makes sense.
because it provides a direct route for bacteria to enter the lungs.
So it's really about looking at all these different factors together to try to get a sense of a patient's overall risk.
It's like putting together a puzzle, trying to piece together all these different clues.
So it's not an exact science.
Not at all. It's very much an evolving field.
So I'm curious, when doctors are trying to figure out who's at risk for these MDR infections, are there any tools that they're using to try to predict this? Like, are there any models or scores or anything like that that they use?
Yeah, there are. And this article talks about something called clinical prediction models and risk scores,
Okay.
which are essentially algorithms that try to predict a patient's risk of developing an infection based on various factors.
That was like a formula.
It is a formula that takes into account things like their medical history,
Okay.
the types of antibiotics they've been on their lab results, things like that.
Okay.
And one example is the Gianella score, which is specifically for predicting the risk of carbapenem-resistant Klebsiella pneumonia bacteremia.
Okay, so the Gianella score, it's looking specifically at that one type of bacteria.
Right. It's tailored to that particular pathogen, and it's based on 5 different variables.
Okay.
Things like whether the patient has been admitted to the ICU, if they've had any abdominal surgery, if they've received chemotherapy, things like that.
So things that might compromise their immune system.
Exactly. Things that might make them more susceptible to these types of infections.
And so the higher the score, the higher the risk.
Exactly. The higher the score, the more likely they are to develop that particular infection.
But it's not a guarantee.
It's not a crystal ball. It's just one piece of information that doctors use to make decisions.
It's a tool.
It's a tool among many.
So they're not relying solely on this score to make treatment decisions.
No, it's just one factor to consider along with the patient's overall clinical picture.
So it's like a warning system, maybe?
Exactly. It's a warning system. It's something that might raise a red flag and prompt further investigation or more aggressive treatment.
Okay, so it's a tool, but it's not the be-all, end-all.
Right. It's
Yeah.
important to keep that in mind.
So we've talked about the challenges of identifying these infections and some of the things that doctors are looking for to assess risk. Now let's talk about how we actually diagnose these infections, because I know that that can be tricky too, and sometimes time is of the essence.
Absolutely. And that's where things get really interesting because there have been some incredible advancements in diagnostic technology in recent years
Okay.
that are really helping us to identify these resistant pathogens much faster than we could before.
Okay, so we're talking about rapid diagnostic tools.
Exactly. Rapid diagnostic tools, or RDTs for short.
RGT's got it.
And these are really changing the game when it comes to managing antimicrobial resistance.
Okay, so before we jump into the specifics of these RDTs, why is speed so important when you're dealing with these types of infections?
Well, the name kind of gives it away, right? Rapid. Rapid, these infections can progress very quickly.
Okay.
And especially in critically ill patients, every hour that goes by without appropriate treatment can make a difference in their outcome.
So it's really a race against time.
It can be, and that's why these rapid diagnostic tools are so critical because they allow us to get answers faster and initiate treatment sooner.
Okay, so let's talk about some of these RDTs. What kind of technology are we talking about here?
So one of the most exciting developments is something called multiplex PCR.
Multiplex PCR.
Okay.
Have you heard of that?
I have heard of PCR, but I'm not sure about multiplex.
So PCR stands for polymerase chain reaction,
Right.
and it's a technique that's been used for a long time to amplify DNA.
Okay.
So basically, it allows us to take a tiny sample of DNA and make millions of copies of it so we can study it more easily.
Got it.
Multiplex PCR takes this a step further by allowing us to amplify multiple targets simultaneously.
So instead of just looking for one specific gene, you can look for multiple genes at the same time.
Exactly. It's like running multiple tests at once.
Okay, that makes sense.
And this is incredibly useful for identifying resistance genes because we can test for a whole panel of them in a single test. So instead of having to wait for multiple different tests to come back, you can get a more complete picture all at once.
Exactly. It streamlines the process and saves valuable time.
And I imagine that's particularly helpful in the ICU setting where you might not have a lot of time to waste.
Absolutely. Time is critical in the ICU, and multiplex PCR has really revolutionized the way we diagnose and manage infections in that setting.
So multiplex PCR is one tool. What other tools are sort of in this RDT arsenal?
Another big one is MALDI-TOF MS.
MALDI-TOF MS. Oh boy.
I know, it sounds like a mouthful.
That's a lot of letters.
It is, but it's a very powerful technology.
Okay.
So MALDI-TOF stands for Matrix-Assisted Laser Desorptionization Time of Flight.
Okay.
And MS stands for mass spectrometry.
Right.
So basically what this technique does is it analyzes the protein makeup of a bacteria
Okay.
and creates a unique fingerprint for that particular species.
So like every bacteria has its own unique protein fingerprint.
Exactly. And we can use this fingerprint to identify the bacteria very quickly and accurately.
So how does that work in practice?
So let's say you have a patient with a suspected bloodstream infection.
Okay.
You would take a blood sample from that patient and send it to the lab.
Right.
And instead of having to wait days for the bacteria to grow on a petri dish, which is the traditional method,
Right.
we can use MALDI-TOF to identify the bacteria directly from the blood sample in a matter of minutes.
That's wow.
It's incredibly fast, and it's very accurate.
So you get a faster diagnosis, which means you can start treatment sooner.
Exactly.
Yeah.
And that can make all the difference in patient outcomes.
Okay, so we've got multiplex PCR, which can identify resistance genes.
Yeah.
We've got MALDI-TOF, which can identify the specific type of bacteria. Are there other RDTs that we should be talking about?
There are, and this article highlights another category called rapid AST systems.
Rapid AST. What does AST stand for?
AST stands for antibiotic susceptibility testing.
Okay, so this is figuring out which antibiotics will actually work against the bacteria.
That's exactly what it does.
Oh.
So traditionally, AST has been done by growing bacteria on a petri dish and then exposing them to different antibiotics to see which ones inhibit their growth.
Okay.
But this process can take several days.
Right.
And by that time, the patient might already be getting worse.
Right, so we need something faster.
Exactly. And that's where rapid AST systems come in.
Okay.
These systems use various methods to speed up the process of determining antibiotic susceptibility.
So we're still figuring out which antibiotics will work, but we're doing it much faster.
Precisely. And this can help to ensure that patients are getting the right antibiotic as soon as possible.
So it's about getting them on the most effective treatment right away.
That's the goal.
Are there any specific rapid AST systems that are kind of leading the pack right now?
There are several different systems available, but one that's mentioned in the article is the Accelerate PhenoTM system.
Okay.
And this system has been shown to significantly reduce the time to optimal antibiotic therapy in patients with gram-negative bloodstream infections.
So it's making a real difference in patient care.
It is, and it's a great example of how these rapid diagnostic tools are being used to improve outcomes for patients with MDR infections.
So it seems like these RDTs have the potential to really revolutionize the way we manage AMR, especially in these critical care settings.
They absolutely do. They're giving us the tools we need to make faster, more informed decisions about antibiotic therapy.
Which is critical when you're dealing with these types of infections.
Absolutely. Every minute counts.
But it's not just about having the technology right. It's also about using it appropriately and making sure that it's integrated into a broader strategy for combating AMR.
You're absolutely right. It's not enough to just have these fancy new tools we need to make sure they're being used effectively, and that's where antimicrobial stewardship programs come in.
Okay, so let's talk about antimicrobial stewardship programs, because I know they're a big part of this whole equation.
They are, and they play a crucial role in ensuring that antibiotics are used appropriately and that we're doing everything we can to prevent the emergence and spread of resistance.
So it's about using antibiotics wisely, not just using them whenever we feel like it.
Exactly. Antibiotics are a precious resource, and we need to treat them as such.
So these antimicrobial stewardship programs, what do they actually involve?
Well, they typically involve a multidisciplinary team of healthcare professionals,
Right.
including doctors, pharmacists, nurses, infection control specialists.
So it's a team effort.
It's definitely a team effort, and they work together to develop and implement strategies to improve antibiotic use.
So what kind of strategies are we talking about?
So one key aspect is ensuring that antibiotics are only prescribed when they're truly necessary.
Okay, so no more just-in-case prescriptions.
Right. We need to move away from that mindset and only use antibiotics when there's a clear indication of a bacterial infection.
Makes sense.
Another important aspect is choosing the right antibiotic for the job.
Okay.
So that means getting a good understanding of the likely pathogens involved
Okay.
and their susceptibility patterns.
So you're tailoring the antibiotic choice to this specific infection.
We call this targeted therapy.
Targeted therapy, got it.
And it's much more effective than just throwing a broad-spectrum antibiotic at the problem and hoping for the best.
Right, because those broad-spectrum antibiotics, they can kill off a lot of the good bacteria along with the bad bacteria.
Exactly, and that can disrupt the body's natural balance and make it more susceptible to future infections.
It's about being more precise in our use of antibiotics.
Precisely.
So antimicrobial stewardship programs are really about making sure that we're using antibiotics in the smartest way possible.
Exactly, and that's essential for preserving the effectiveness of these life-saving drugs for future generations.
Right, because if we don't, we're going to run out of options.
We will, and that's a very scary thought.
So we've got these amazing new diagnostic tools that are helping us to identify these MDR infections faster. And we've got these antimicrobial stewardship programs that are helping us to use antibiotics more wisely. But what happens once we've identified an infection and we know we need to treat it? What are some of the strategies that doctors are using to optimize treatment for these MDR infections, especially in critically ill patients? Because I imagine that can be really tricky.
It can be very challenging, and that's an area where there's a lot of ongoing research and innovation.
Okay.
Because it's not just about choosing the right antibiotic anymore. It's about using the right antibiotic in the right way at the right dose for the right duration.
So it's about getting very personalized with our treatment plans.
Exactly. It's about tailoring treatment to the individual patient and their specific circumstances.
And this article talks about a few different strategies for optimizing treatment.
It does.
So let's dive into those.
Sounds good.
One of the terms that I kept seeing pop up was this idea of therapeutic drug monitoring, or TDM. What exactly is therapeutic drug monitoring and how does it work?
So therapeutic drug monitoring is basically a way of measuring the concentration of a drug in a patient's bloodstream.
Okay.
So we can make sure that they're getting the optimal dose.
Okay, so it's not just about giving everyone the same dose. It's about figuring out what dose is right for that particular person.
Exactly, because people metabolize drugs differently.
Right.
And what might be the right dose for one person might be too high or too low for another person.
Okay.
And that's especially true in critically ill patients
Okay.
who often have altered drug metabolism due to things like organ dysfunction.
So their bodies might process the drugs differently.
Exactly.
So how does TDM work in practice?
So let's say we have a patient in the ICU with a serious MDR infection.
Okay.
And we've started them on an antibiotic.
Right.
With TDM, we would take regular blood samples from the patient
Okay.
and measure the concentration of the antibiotic in their blood.
Okay.
And then we would use that information to adjust the dose as needed.
So you're constantly monitoring and adjusting to make sure that they're getting the right amount of the drug.
That's the idea.
And I imagine this is particularly important with these MDR infections because you want to make sure that the drug is actually working.
Absolutely, because if the drug levels are too low, the bacteria might not be killed effectively.
Right.
And if the drug levels are too high, it can increase the risk of side effects.
So it's about finding that sweet spot
Exactly.
where it's effective but also safe.
Precisely.
Okay, so TDM is one strategy.
Sure.
What other strategies are doctors using to try to optimize treatment for these MDR infections?
Another approach that's being investigated is combination therapy.
Okay, so that's using multiple antibiotics at the same time.
Right. The idea is to hit the bacteria with multiple drugs that work in different ways to make it harder for them to develop resistance.
So it's like overwhelming their defenses before they even have a chance to figure out what's going on.
Exactly. And there's some evidence to suggest that this can be effective for certain types of MDR infections.
Okay.
For example, there have been studies that have shown that combination therapy can be beneficial for bloodstream infections caused by carbapenem-resistant enterobacterales,
Okay.
which are a particularly nasty type of MDR bacteria.
Right.
But combination therapy is not without its challenges.
Okay.
One of the biggest concerns is the risk of side effects.
Right, because you're using multiple drugs, which means you're increasing the risk of potential interactions and side effects.
And that's something that has to be carefully weighed against the potential benefits.
So it's not a decision that's taken lightly.
No, it requires careful consideration and monitoring.
So we've got TDM, we've got combination therapy. Are there other strategies that are being explored for optimizing treatment?
Another area that's getting a lot of attention is the role of the patient's immune system,
Okay.
because we know that the immune system plays a critical role in fighting off infections.
Right.
And so there's a lot of interest in developing therapies that can boost the immune response to help fight off these MDR infections.
So it's not just about killing the bacteria, it's also about helping the body fight back more effectively.
Exactly. It's about supporting the body's natural defenses.
So it's a multi-pronged approach.
It is, and it really highlights the complexity of managing these infections.
So we're learning more all the time.
We are, and that's why it's so important to stay up to date on the latest research and treatment guidelines.
Absolutely. So this has been a really fascinating look at the challenges and the potential solutions surrounding antimicrobial resistance, especially in the ICU setting. But before we wrap up, I'm curious, is there one key message that you hope our listeners take away from this discussion?
You know, I think the most important thing for people to remember is that antimicrobial resistance is a complex problem,
Right.
but it's not an insurmountable problem.
Okay.
There are things that we can do both individually and collectively to address this issue.
So it's not hopeless.
Not at all.
We can still turn things around.
Absolutely.
So what can we do? What are some of the things that our listeners can do to help combat antimicrobial resistance?
Well, one of the most important things is to be aware of the issue. And to understand the role that antibiotics play in both human and animal health.
Right, because it's not just a human health issue, it's an animal health issue as well.
Exactly. It's a one health issue.
Right.
And what happens in one sector can have ripple effects on the other sectors.
So we need to be thinking about this holistically.
Exactly.
Okay, so awareness is key. What else can we do?
Another important thing is to be responsible stewards of antibiotics.
Okay, so what does that mean in practical terms?
It means only taking antibiotics when they're truly necessary
Okay.
and following the instructions of your healthcare provider carefully.
So no skipping doses?
No skipping doses and finishing the entire course of antibiotics, even if you start to feel better before you've finished all the pills.
Okay, because that can actually contribute to the development of resistance.
It can, because it can leave behind some of the bacteria that are more resistant to the antibiotic.
Okay, so be responsible with our antibiotics. What else?
And we can also advocate for policies that support responsible antibiotic use.
So talking to our elected officials.
Exactly, letting them know that this is an important issue to us and that we support policies that promote responsible antibiotic use in both healthcare and agriculture.
So it's about using our voices to make a difference.
Exactly.
Okay, so awareness, responsible use, advocacy, those are all great things that we can do with individuals, but what about on a larger scale? What needs to happen to really tackle this problem?
Well, one of the biggest challenges is the lack of new antibiotics in the pipeline.
Okay.
So we need to incentivize the development of new antibiotics.
Okay, so we need more research and development in this area.
Absolutely.
Okay.
And we need to make sure that these new antibiotics are used appropriately.
Right, so we don't want to just repeat the same mistakes of the past.
Exactly.
Okay.
We also need to improve infection prevention and control measures.
Okay, so things like hand washing.
Hand washing is huge.
Okay.
And then proper disinfection of surfaces. Isolation of patients with MDR infections.
Okay.
All of those things are critical for preventing the spread of these resistant organisms.
So it's about creating a culture of safety and hygiene.
Exactly.
Okay.
And then finally, we need to improve global surveillance of antimicrobial resistance.
Okay.
So that we can track the emergence and spread of these resistant organisms.
So we can stay ahead of the curve.
Exactly, because this is a global problem and it requires a global solution.
Absolutely. Well, this has been a really eye-opening discussion. I feel like I've learned a lot.
Me too.
And I hope our listeners have as well. And I hope that they feel empowered to take action.
I hope so too.
Because this is something that affects all of us.
It does.
And we all have a role to play in addressing it.
Absolutely.
So thank you so much for joining us for this deep dive into the world of antimicrobial resistance. We've covered a lot of ground.
We have.
But I think this is just the beginning of the conversation.
I agree.
And we're going to continue to follow this issue closely and keep you updated on the latest developments.
Sounds good.
So until next time, stay curious, stay informed, and stay healthy.
Great advice.
All right, so we're back and ready to dive into the world of these rapid diagnostic tools that you mentioned.
Yeah.
Because it seems like, speed is really of the essence when you're talking about these types of infections.
Absolutely, every hour counts when you're dealing with these MDR pathogens, especially in critically ill patients.
So can you give us a rundown of what these rapid diagnostic tools, or RDTs, as I guess the cool kids call them,
Right.
what they can actually do?
Yeah, so there are a few different types of RDTs that are really making waves in this field. One of the most exciting is something called multiplex PCR.
Multiplex PCR.
Have you ever heard of PCR before?
I have. I've heard of PCR, but I'm not as familiar with multiplex.
Okay, so PCR stands for polymerase chain reaction.
Right.
And basically, it allows us to take a tiny sample of DNA and make millions of copies of it so we can study it more easily.
It's like blowing it up.
Exactly. It's like putting it under a microscope, but for DNA. So multiplex PCR takes this a step further by allowing us to amplify multiple targets simultaneously.
Oh, okay. So instead of just looking for one specific gene, you can look for multiple genes at the same time.
Exactly. It's like running a whole bunch of tests at the same time.
So it's a lot faster.
Way faster. And this is incredibly useful for identifying resistance genes because we often want to know not just if a bacteria has a resistance gene, but what specific genes it carries.
So you can get a more complete picture of its resistance profile.
Exactly. And that helps us to choose the most effective antibiotic for treatment.
That makes a lot of sense.
And it's especially valuable in situations where time is critical, like in the ICU, where you might not have the luxury of waiting days for traditional culture results.
Right. You need to know what you're dealing with right away.
Exactly.
So multiplex PCR is one tool. What other RDTs are out there?
Another really cool one is MALDI-TOF-MS.
MALDI-TOF-MS.
Yeah.
Okay, that one's a mouthful.
I know it sounds like a mouthful, but it's a very powerful technique.
So break it down for me.
Okay, so MALDI-TOF stands for Matrix-Assisted Laser Desorptionization Time of Flight.
Okay.
And MS stands for mass spectrometry.
Right.
It's a way of identifying microorganisms based on their protein makeup.
Our protein makeup. Okay.
Yeah. So basically, every bacteria has its own unique set of proteins.
Okay.
It's kind of like a fingerprint.
Oh.
And with MALDI-TOF, we can analyze these proteins and create a profile that's specific to that particular species.
So you can identify the bacteria very quickly and accurately.
Exactly. And it's much faster than traditional methods, which can take days.
So how does this work in a clinical setting?
So let's say you have a patient with a suspected bloodstream infection.
Right.
You would take a blood sample from that patient, and instead of having to wait for the bacteria to grow in a culture, which can take several days,
Right.
we can use MALDI-TOF to identify the bacteria directly from the blood sample in a matter of hours or even minutes.
Wow. So that's a huge time saver.
It's a game changer,
That's a time.
especially for critically ill patients.
So we've got multiplex PCR, which can identify resistance genes. We've got MALDI-TOF, which can identify the bacteria itself. Are there other RDTs that are being used?
There are, and another important category is rapid AST systems.
Rapid AST. What does AST stand for?
AST stands for antibiotic susceptibility testing.
Okay, so this is figuring out which antibiotics will actually work against the infection.
You got it. That's exactly what it's for.
Okay.
And traditionally, AST has been a time-consuming process
Right.
because it involves growing the bacteria in the presence of different antibiotics to see which ones inhibit their growth.
Okay.
But with rapid AST systems, we can get these results much faster.
So we can get patients on the right antibiotic sooner.
Precisely, and that can make a big difference in their outcome.
Are there any particular rapid AST systems that are showing promise?
Yeah, there are several, but one that's mentioned in the article is the Accelerate Pheno-TM system.
Okay.
And this system has been shown to reduce the time to optimal antibiotic therapy by up to 24 hours in some cases.
24 hours. That's incredible.
It is, and it just highlights the potential of these rapid diagnostic tools to really improve patient care.
So it seems like these RDTs have the potential to really revolutionize the way we approach AMR, especially in critical care settings.
They do. They're giving us the information we need to make faster, more informed decisions about antibiotic use.
Which is critical when you're racing against the clock.
Exactly. Every minute matters.
So we've talked about the challenges of identifying these MDR infections, and now we're seeing all of these amazing new technologies that are helping us to speed up diagnosis and treatment. But what about once we've identified an infection? What can we do to actually fight back against these superbugs, especially in these critically ill patients? What does the research say about optimizing treatment? So we've talked about the challenges of identifying these MDR infections and all these incredible new technologies that are helping us to speed up diagnosis and treatment. But what about once we've identified an infection, what can we do to actually fight back against these superbugs, especially in these critically ill patients? What does the research say about optimizing treatment?
Well, it's not as simple as just throwing any antibiotic at the problem anymore.
Right.
We really need to think about how to use these drugs in the most effective way possible, and that's especially true in the ICU, where patients are often dealing with multiple health issues, and their bodies might not respond to treatment in the same way as a healthier person.
Right. So it's not one size fits all.
Exactly. It's about tailoring treatment to the individual patient.
So how do we do that? What are some of the strategies that doctors are using to try to optimize treatment for these MDR infections?
One approach that's gaining a lot of traction is something called therapeutic drug monitoring, or TDM for short.
TDM.
Mm.
Okay, I've heard that term before, but I'll admit I'm not entirely clear on what it means.
So basically, TDM involves measuring the concentration of an antibiotic in a patient's blood over time
Okay.
to make sure that they're getting the optimal dose.
Okay, so it's not just about giving everyone the same dose. It's about figuring out what dose is right for that particular person.
Exactly, because as I mentioned before, people metabolize drugs differently, and what might be the right dose for one person could be too high or too low for another person.
Right, so how do you actually do that? How do you measure the concentration of an antibiotic in someone's blood?
It involves taking regular blood samples from the patient and then analyzing those samples to see how much of the drug is present.
Okay, and then you use that information to adjust the dosage as needed.
Precisely so. If the drug levels are too low, we might need to increase the dose.
Okay,
And if they're too high, we might need to decrease the dose or adjust the timing of the doses.
this is a very personalized approach.
It is, and it's especially important in critically ill patients because they often have other things going on that can affect drug metabolism, like kidney or liver problems.
Right, so their bodies might not process the drugs in the same way as a healthy person.
Exactly. And TDM allows us to take those factors into account and adjust treatment accordingly.
So it's about finding that sweet spot where the drug is effective but also safe.
Exactly. We want to make sure that the patient is getting enough of the drug to kill the bacteria, but not so much that it causes harmful side effects.
Right, so TDM is one strategy. What other strategies are being used to optimize treatment?
Another approach that's showing promise is combination therapy.
Combination therapy, meaning using multiple antibiotics at the same time.
Exactly. The idea is to hit the bacteria with multiple drugs that work in different ways
Okay.
to make it harder for them to develop resistance.
So it's like overwhelming their defenses.
Exactly. And for some types of infections, like those caused by carbapenems producing enterobacterales, combination therapy has been shown to improve outcomes.
So it's not always the right approach, but in certain cases it can be very effective.
Right. It really depends on the specific circumstances.
This has been a fascinating look at antimicrobial resistance, the challenges, the breakthroughs. And it seems like the world of medicine is really stepping up to the plate to try to address this issue.
I think so too. There's a lot of great research being done and a lot of promising new approaches being developed.
That's good to hear.
But it's going to take a concerted effort from everyone to really tackle this problem.
Absolutely. It's not just a healthcare issue, it's a global health issue.
Exactly. Everyone has a role to play.
Well, thank you so much for taking the time to break all of this down for us. It's been incredibly informative.
My pleasure. Glad I could help.
And for our listeners out there, be sure to check back for more deep dives on the latest scientific research. We're here to keep you informed and empowered to take charge of your health.
Absolutely. Knowledge is power.
Till next time, stay curious, stay informed, and stay healthy.